Hey, I'm Dr. Dino Pappas. I'm coming to you today with some information about sleep. I've been asked so many questions over the years by patients. That's why I decided to make this video. Doc, is there a best posture? Is there a best bed? Are there best habits to get good quality night sleep? I'm going to rewind here. Sleep is absolutely critical to us as human beings. It allows us to rejuvenate, to refresh. Without good quality sleep, people feel more pain, they have more difficulty, they start to have some psychological disturbances of anxiety and depression if they can't get good sleep. So it's very important. That's why I'm making this video for patients and also for just the general lay person that have asked me questions over the years. First, is there a best sleep posture? The answer to the question is no. I do not believe that there is a best sleep posture. I believe that there are better postures for certain people and poor choices for certain people. For example, some people will do just fine sleeping on their back. And if they get good quality sleep sleeping on their back, let's emphasize that position as much as possible. Same thing with side sleeping. If you get good quality sleep sleeping on your sides, let's continue to have you sleep on your sides as long as that good quality sleep continues. There are a couple principles that are important. First most important thing, I like, if you are sleeping on your side, to keep everything in the same plane. So the head's not tilted up, the head's level with the torso, the shoulders, the hips, and the legs are all in the same plane with the pillow between your knees. I try to keep people out of the fetal position here. Again, the knees and the hips are outside the plane of the body. Why? Because rolling forward into the fetal position can be detrimental for certain types of patients. So try to keep everything level on your side. Same thing on your back if you need it. The next question was sleep posture. Is it okay if I sleep on my stomach? And I don't have a problem with patients sleeping on their stomach if they get good quality sleep. There are a couple important principles. I will recommend a prone pillow or a massage pillow, which will allow them to keep the head level and not in a rotated position here. All right. In some cases, patients with certain types of back pain prefer sleeping on their stomach because it encourages neutral position or extension of the back. So I believe there are certain good choices for patients and other choices that are not so good. So there is no one best sleep posture. Hey, Dr. Pappas, is there a best bed? The answer to the question is no. There are good choices for certain people and bad choices for certain people. If you're a stiff, very unflexible, not very mobile person, typically you'll benefit from a more soft bed, soft support. It's the opposite of what your body type is. If you are loose, lax, extremely flexible, typically you'll benefit from a bed that has more stability or more rigidity. That's why it's important that you try as many beds as you possibly can to find something that works for you. All right. Hey doc, what are the best sleep habits? Well, things that I recommend frequently to patients are electronics. Try to reduce electronic usage within 2 to 3 hours of you going to bed. The blue light stimulation triggers a very primitive part of that brain. And that primitive part of your brain will actually keep the mind working longer than what the device has been on. So you don't just shut the device off and your brain stops working. There is a carryover period. So within 2 to 3 hours, try not to use electronic devices. Hey doc, temperature. It is true, when we drop the temperature, we make the room cooler, typically induces more quality sleep. So consider dropping the temperature several degrees over the course of the night to try to prepare yourself to go to bed. What about exercise? Try not to vigorously exercise. That is a stimulant for the body, stimulant for the brain, stimulant for the nervous system. Try to avoid vigorous exercise, again, within 2 to 3 hours of going to bed. And it is okay if you choose other things like breathing, meditation, Tai Chi, things that have a tendency to kind of relax the central nervous and autonomic nervous system. So no vigorous exercise, but it is okay to breathe and meditate within a couple hours of going to bed. What about nutrition? Well, things that promote lack of good quality sleep: caffeine, nicotine, alcohol. Caffeine and nicotine happen to be stimulants. You don't want those. What about alcohol? Well, alcohol reduces the number of quality sleep cycles. So you may sleep more, but the quality of sleep may be reduced with alcohol. Doc, what about supplementation? Well, supplementation, things like melatonin, if you have a melatonin deficiency, supplementing melatonin may be beneficial for you to provide sleep. Check with your physician if that is the right option for you. It may require some testing. Also, if you have a magnesium deficiency, magnesium is a relaxant, nervous system and muscle relaxant. That may help, particularly if you have a magnesium deficiency. Some other supplements that may provide a relaxing effect on the body: chamomile, passion fruit, valerian root, also hops. There are supplements out there that have that has shown some initial effects on inducing relaxation to affect your sleep. Again, check with your physician if those options are right for you, because it may require looking at medication, what medications you're taking, and what your deficiencies are in your blood work. All right. Consistency is also important. Getting the same schedule is critical to developing patterns and habits. And the more that you're able to maintain that pattern, that habit, the more refreshed that you'll feel, the better quality sleep that you'll get. I'm Dr. Dino Pappas. Please shoot me an email if you have any questions. I put out this video for our patients to get good quality sleep because it's critical for you, for your livelihood. Thanks.